We're all about wanting to reduce barriers to getting your flu vaccines.
All right, here we are. Ready?
So we're meeting people where they are at times that maybe that they wouldn't normally be able to come into our clinic here in Columbia to get that vaccine. And we're going to 9 different community venues. Everybody can come into those areas. Kids, young adults, older adults, whichever is most convenient for them.
Here we go. 1, 2, 3, 4.
I think any time that you can make it convenient for people to bring it into the community for them to be able to get those vaccinations, it helps in a lot of ways. It's convenient for the parents. They don't have to find a doctor's office or the health department to go to, and they don't have to be here with the kids to get it done. We have a lot of seniors that come in, and it gives a lot of our elderly people in the community a chance to not have to drive to go get those vaccinations. We had 600 sign up to do the flu or the mist this year, and that's just up each year.
Last season we had 57 schools that participated in the school-based flu program. So those are public schools and participating private schools in Columbia and Boone County that will go there, elementary, middle, and high school, and provide flu vaccines on a certain day. And then this year we provided the consent forms earlier in the year, and so we're seeing an uptick in people wanting to get their free flu vaccine because they received their consent forms early on and they know that we're coming. Last year, between the school flu clinics, the community outreach clinics, people coming into our clinic here, and then other outreach efforts, so like going to preschools and things like that, we were able to vaccinate over 10,400 kids last year against the flu, which is awesome. One of the city's strategic priority areas for the new strategic plan surrounds social equity and improving the odds for success. And so we know that people getting their vaccination increases the likelihood that they'll be able to stay healthy throughout the season. So if you get your flu vaccine, maybe you're not staying home from work being sick, maybe you're not in the hospital, overall improving your odds for success. And so providing the vaccines out in the community as well as going into the schools and providing the school-based flu clinics allows us to reduce those barriers to success. So that could be reducing financial barriers by offering free flu vaccine for kids age 6 months through 18 years. Could be transportation barriers. Maybe you don't have the ability to bring your kiddo into the clinic. We'll meet you at your school. Or maybe you live in Ashland or Sturgeon and we're going to meet you there instead, and so you don't have to worry about that time commitment either. So we recommend that annually you go ahead and take the opportunity to be proactive and get your flu vaccine each year, and then we also recommend that you practice common sense hygiene. So washing your hands for 20 seconds after you touch your face, go to the restroom, touch food, things like that. Coughing into your cough pocket, I call it the Dracula cough. And staying home from work or school when you're sick or not feeling well, just kind of to limit the spread of the illness.